fear and panic that are spread due to the new coronavirus strain, also known as COVID-19, can be mitigated by equipping yourself with proper knowledge, good hygiene, and cooperating with your local medical facilities. Here are some facts that you need to know about COVID-19. Share this information regarding coronavirus disease 2019 COVID-19 and help stop rumors and false news being spread over the internet. Coronaviruses (CoV) are a large family of viruses that can cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome (MERS-CoV) and Severe Acute Respiratory Syndrome (SARS-CoV). Coronavirus disease COVID-19 is a new strain that was discovered in 2019 and wasn't previously identified in humans. First fact: COVID-19 virus can be transmitted in areas with hot and humid climates. From the evidence that was gathered so far, the COVID-19 virus can be transmitted in all areas, that includes areas with hot and humid weather. Regardless of climate in your country or region, adopt personal protective measures and equipment if you live in, or travel to an area reporting COVID-19. The best way to protect yourself against COVID-19 is by frequently cleaning your hands by alcohol-based hand rub or alcohol. By doing this, you eliminate viruses that may have unknowingly transmitted on your hands and avoid infection that could occur by avoiding constant touching of your eyes, mouth, and nose. Second fact: there is no reason to believe that cold weather could kill the new coronavirus or other diseases. The normal human body temperature remains around 36.5 degrees Celsius to 37 degrees Celsius, regardless of the external temperature or weather in your respective areas. Third fact: taking a hot bath will not prevent you from catching COVID-19 and other diseases. The normal human body temperature remains at around 36.5 degrees Celsius to 37 degrees Celsius, regardless of the temperature of your bath or shower. Actually, taking a hot bath with extremely hot water can be harmful, as it can possibly burn you. Fourth fact: up to the present, there has been no information nor evidence to suggest that the new coronavirus could be transmitted by mosquito bites. The new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. Fifth fact: hand dryers are not exactly effective in killing the 2019 nCoV or any other diseases. To protect yourself against the new coronavirus, you should frequently clean your hands with an alcohol-based hand rub or wash them with soap and water. Once your hands are cleaned, you should dry them thoroughly by using paper towels or a warm air dryer. Sixth fact: ultraviolet lamps should not be used to sterilize hands or other areas of skin, as ultraviolet radiation can cause skin irritation. Seventh fact: thermal scanners are effective in detecting people who have developed a fever, i.e. have a higher than normal body temperature because of infection with the new coronavirus. However, they cannot detect people who are infected but are not yet sick with fever. This is because it takes between 2 and 10 days before people who are infected become sick and develop a fever. Eighth fact: spraying alcohol or chlorine all over your body will not kill viruses that have already entered your body. Spraying such substances can be harmful to clothes or mucous membranes, i.e. eyes, mouth. Be aware that both alcohol and chlorine can be useful to disinfect surfaces, but they need to be used under appropriate recommendations. Ninth fact: vaccines against pneumonia, such as pneumococcal vaccine and Haemophilus influenza type B (HIB) vaccine, does not provide protection against the new coronavirus. The virus is so new and different that it needs its own vaccine. Researchers are trying to develop a vaccine against 2019 nCoV, and WHO is supporting their efforts. Although these vaccines are not effective against 2019 nCoV, vaccination against respiratory illnesses is highly recommended to protect your health. 10th fact: there is no evidence that regularly rinsing the nose with saline has protected people from infection with the new coronavirus. There is some limited evidence that regularly rinsing nose with saline can help people recover more quickly from the common cold. However, regularly rinsing the nose has not been shown to prevent respiratory infections. 11th fact: garlic is a healthy food that may have some antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the new coronavirus. 12th fact, people of all ages can be infected by the new coronavirus 2019 MERS-CoV. Older people, and people with pre-existing medical conditions such as asthma, diabetes, heart disease, appear to be more vulnerable to becoming severely ill with the virus. WHO advises people of all ages to take steps to protect themselves from the virus, for example by following good hand hygiene and good respiratory hygiene. 13th fact, antibiotics do not work against viruses, only bacteria. The new coronavirus 2019 MERS-CoV is a virus and, therefore, antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized for the 2019 MERS-CoV, you may receive antibiotics because bacterial co-infection is possible. 14th fact, to date, there is no specific medicine recommended to prevent or treat the new coronavirus 2019 MERS-CoV. However, those infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care. Some specific treatments are under investigation, and will be tested through clinical trials. WHO is helping to accelerate research and development efforts with a range of partners. 15th fact, fear and anxiety about COVID-19 can cause people to avoid or reject others even though they are not at risk for spreading the virus. 16th fact, someone who has completed quarantine or has been released from isolation does not pose a risk of infection to other people. 17th fact, there are simple things you can do to help keep yourself and others healthy. Wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing, or sneezing, going to the bathroom, and before eating or preparing food. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. 18th fact, you can help stop COVID-19 by knowing the signs and symptoms and then reporting to the local medical facility for assistance: runny nose, sore throat, cough, fever, difficulty in breathing, severe cases. These information were gathered from the World Health Organization (WHO) and Centers for Disease Control and Prevention (CDC). Thank you for watching this video. We hope you liked it as much as we do in sharing information. If you liked this video, please share and subscribe to our channel. Click on the notification icon to receive updates when new content is uploaded. You can also check out our other videos and playlists in our channel.